Hello everyone, my name is Ray. I'm a nurse practitioner who specializes in cardiology. And in this video, I just wanted to talk to you a little bit about some of the ways that we check for coronary artery disease or somebody that has blocked arteries. There's three main ways that we check. I'll go with the best way to check for blockages in the arteries of the heart. It's called the heart catheterization. That is the gold standard, but that's also the most invasive and carries the most risks. Another way that we can check is something called a stress test. You've probably heard of that before. Stress test is, there's actually different kinds of stress tests. You can do what they call a chemical stress test. Basically, they give you a medication in your IV, essentially stressing your heart rather than walking on a treadmill. That's the other way that we can do a stress test, is actually do what they call an exercise stress test. And it has its limitations, but certainly has its benefits. And then there's another way that is the main thing that I wanted to portray to you guys, especially people that have anybody that's got family history, mom, dad, siblings, somebody that had a heart attack, especially prematurely. There's a very good test. It's called a coronary CAT scan. And in that coronary CAT scan, there's actually two parts of it. The first part, depending on your age, is something called a calcium score. That basically tells us if there's any calcium built around the outside of the arteries of the heart. Sometimes if you have an elevated calcium score, that does correlate with blockages on the inside of the arteries. However, that's not always the case. I've had patients that have had severely elevated calcium scores, and then they didn't have any what we call obstructive coronary disease on the inside of the arteries of the heart. But then the second portion of the coronary CAT scan, it's actually called a CCTA, or coronary CT angiography, or angiogram. Basically, that's where they do the same thing, the calcium score, but then they also do a second part where they inject something called contrast. You'll have an IV started for that. It's a one-day test. You can do it as an outpatient. And in some cases, if you come to the hospital, complaining of chest pain, we might do it while you're in the hospital. But that is an excellent, excellent test. Again, if you're somebody that has heart disease in your family, especially premature, a CCTA might be something that you might want to discuss with your primary care provider. Usually they'll refer you to a cardiologist, but excellent test. It may save your life, guys. So I'll see you in the next video. Please make sure to share this with someone that you know and love that has heart disease. And let me know if you have any questions.